Okay, so here I've got the model from the lab. This is sagittal plane model of the head, and we're going to talk through some respiratory structures here. So to start with, we've got the upper respiratory tract, which is basically what this model is showing you. And when we breathe air in, it can come in one of two ways. So we can breathe air in through our nasal cavity, which is what this is showing you here. Air is going to come in through your nostrils and travel across these three bony ridges. These are your nasal concha. You might remember those from when we did skeletal system. So here's superior, middle, and inferior nasal concha. If we head back to the posterior aspect of the nasal cavity, this structure right here is the eustachian tube, also known as the pharyngotympanic tube, and that connects the posterior nasal cavity to the ear. We can also see this structure right here, this little collection of tissue, and this is lymphoid tissue. This is one of the sets of tonsils that you have in this area. These are your pharyngeal tonsils, otherwise known as adenoids. So if you've ever known anyone who's had their adenoids removed because maybe snoring or they become inflamed when they're sick, it's this collection of tonsils right here. So if we go just inferior to the nasal cavity, we find the oral cavity. So this is the tongue, and this is our oral cavity here. So we do have this wall separating oral from nasal cavity, and this is our palate. So if you look in cross-section, you can see that the anterior palate is the bony palate. It's formed by bone. And then the posterior palate is called the soft palate because it's formed by soft tissue. We also have this structure here that hangs off the posterior aspect of the soft palate, and this is the uvula. So what this does is as you eat food and food travels to the posterior aspect of your oral cavity, that uvula is actually going to flip up and cover this opening here so that food can't go from your oral cavity back up into your nose. Now we know sometimes that does happen and we choke on spaghetti or whatever we're drinking, so sometimes it doesn't always work as planned, but that's its intention. Okay. If we look at the posterior aspect of the oral cavity here, we see this second collection of tonsils, and this is the palatine tonsils. These are the ones, if you open your mouth and you look to the back of your oral cavity, if they're inflamed, you'll see kind of these whitish spots on those palatine tonsils. Okay. And this brings us back to this region here. This is our pharynx. This is also part of the upper respiratory tract, and we can actually divide pharynx up into three different regions. We have nasopharynx, which is going to be the most superior part. It's on the posterior aspect of the nasal cavity. We have oropharynx, which is going to be this region here, corresponding with the oral cavity. And then we have laryngopharynx, which is going to be here. And that's going to correspond with the larynx, which is going to be this structure right here. And I'm going to do the larynx separately, but there are a couple structures here that we can see. This tissue right here, this is a flap of elastic cartilage called the epiglottis. And what this does is, if you look here, we've got a common passageway. We've got food and air that's traveling down, and we need to be able to separate them because this is trachea. This is going to head down to the lungs. If you go just posterior to that, here's our esophagus, and that's going to head down to the stomach. So what we don't want is food traveling down and coming into our trachea to end up in our lungs. That's not great. So what the epiglottis does is when you swallow, it basically folds over, and it's going to cover the entrance of the trachea so that food gets routed down the esophagus and you don't breathe it into your lungs. That's kind of one of the most notable structures down here for this one.